November is Epilepsy Awareness Month. According to the Cleveland Clinic, in the U.S., more than 450,000 children under 17 years old have been diagnosed with the disorder, which causes recurrent seizures. Dr. Deborah Holder is the Director of Pediatric Epilepsy at Cedars-Sinai Guerin Children, and she's here to talk about how genetic testing is helping to personalize treatment. Thank you so much for being with us this morning.
Thank you for having me.
Yeah, so first let's start and talk about epilepsy. Is it always a genetic condition? I was asking you this.
Yeah, not always. About 50% of people who have epilepsy will have an underlying genetic cause.
Okay, and then if it's not genetic, then what can cause it?
Lots of things, sometimes head injury, sometimes a birth injury, sometimes the brain is malformed at birth. There's lots of other causes, sometimes infection.
Okay.
Lots of things.
And I understand sometimes the symptoms can be subtle. So how do you know someone has epilepsy?
Absolutely. I tell my families that any funny spell that happens more than once can be a seizure. So if you see someone you love, a child, a parent, a caregiver, anyone having a funny spell that happens more than once, you should think seizures. It can be anything, a funny taste in the mouth, a funny feeling, a funny behavior. Anything that happens more than once can be a seizure. You really need to go to a doctor and you need to say, I think I might be having a seizure, and get the appropriate testing done to make the diagnosis.
So an odd taste in your mouth could be a seizure?
Anything, a funny smell, a funny just staring spells. We have a lot of kids who just stop, pause, stare, and then go right back to what they're doing, and that can be a seizure.
Interesting. Okay, so that happens. You go to the doctor and say, I think I had a seizure, and then what do they do next?
So the best test is a brainwave test called an electroencephalogram. We put stickers on the head and we monitor the brain waves, and that can give us a lot of information about whether someone might be having a seizure. This is an easy, non-invasive test.
Wow, this is also fascinating. You were telling me today that you're doing some really exciting research when it comes to gene therapy in epilepsy. Tell us more about that.
Yeah, so we've identified hundreds of genes that now cause epilepsy. I like to think it gives me kind of my crystal ball. Every time someone sees me and we've diagnosed them with epilepsy, the parents want to know what's going to happen. What's going to happen to my child? Are the seizures going to get better or worse? Is there a treatment that we can use?
Right.
And we now have, in this day and age now, 2025, gene-modifying therapy available for some genes for epilepsy. We've just recently started a trial across the country at Cedars-Sinai Guerin Children. We're a site for that trial, and we now can actually fix the epilepsy at the root of the cause, at the genetic level.
Wow.
Yeah,
and
it's amazing.
Can you do that at any age?
We're enrolling children from 2 to 18, so we can use those children across the age span. We think the younger children may have a little bit better response because they haven't had epilepsy as long, but we're hoping that we can help kids across the age span.
This is really fascinating. Are people typically diagnosed with epilepsy very young, or do you see adults?
Across the age span, we see seizures at all ages. I like to think of epilepsy as kind of an equal opportunity disease. Anyone can be diagnosed with epilepsy at any time, so really everybody should educate themselves about epilepsy, the signs and symptoms, and when they need to seek out treatment.
You are doing such fascinating work, and I know you were telling me that you didn't think science would get this far in your lifetime. Isn't it kind of beautiful to see?
It's amazing. It's a great time to be in the field of neurology. I didn't know that we'd find so many genes. When I first started, we tell people we think this is going to be genetic. Now we have hundreds of genes we can identify, and now we actually have treatment.
Very fascinating. So I know a lot of the parents are into like genetic testing and stuff now. Is this something that would come up on a genetic test?
Yeah, so genetic testing should be done, but not the genetic testing you do yourself and send in the mail. This is genetic testing has to be done at a doctor's office. But the amazing thing is we do it just with the cheek swab, so we don't even have to get blood. So really anybody with a diagnosis of seizures or epilepsy should have genetic testing to see if we can find a cause for the epilepsy.
Fascinating. Well, I hope that this gene therapy trial that you're doing goes really well. Thank you so much for being with us and for all you do for those wonderful patients.
Thank you for having me.